We about ready to start, folks?
And we have
Yes, ma'am.
I know you need to get back to work.
Yes.
ready when you are.
We got some people viewing.
214.
Oh my goodness gracious, thank you all. Good afternoon, I'm Paige Brown. I'm the mayor of the city of Gallatin, and we appreciate you joining us for this Facebook Live. We want to have the opportunity to give you an update, and we may continue to do this on a more regular basis. You've seen our kind of official Baker and Brown, and we're not doing that today because we wanted to come to you live. But Kim is going to be joining me in a few minutes, and we'll give you an abbreviated little version and call it that. But I want to address some questions we've had. I want to share some information, and I want to say thank you. I really want to thank our community. You're doing so well in these unprecedented times. I want to thank you for following the guidelines, for being civil to each other. I know it's anxious times for all of us, and you are being kind to each other, and I appreciate that. And I remind you to continue to extend grace and kindness to each other. I think you probably, if you're on Facebook right now, you probably know this already, but there are 2 confirmed cases of COVID-19 in Sumner County. I want to really emphasize that that does not mean that we need to panic. Realize these cases have been around. There are about 200,000 people in Sumner County, and we don't need to panic. We need to keep doing exactly what we've been doing. I personally advise people all around me, act as if everyone around you has the virus. That's why we're doing all the things that we're doing. And so I advise you to do that. And let's spread that information to one another. I am very excited, and I think this will be very helpful for you all to be joined by Dr. Geoffrey Lifferth. He's the Chief Medical Officer at Sumner Regional Medical Center, and he has graciously left the hospital, which is probably a rare opportunity for you these days. But he's left the hospital for a few minutes to come talk with me, to talk to you, to just share some information, because I said last night, and this is so true, we crave facts.
Sure.
And that's been hard for everybody. So tell us what we all need to be doing right now.
Sure. Well, Mayor, thanks for having me. Nice to be here with you.
Thank you so much.
A lot of the things that are the most important are the simple things that you already mentioned. I'd start by saying I think the first thing that's important is that everyone recognizes that this is a serious thing. I know some people have been skeptical. Is this real? Is this really happening? It is real, and it's serious, and I think we need to treat it like that. The things that you talked about, the social distancing that our national political leaders and health leaders are suggesting, I think is very important. The coronavirus is very contagious, probably a little bit more contagious than seasonal flu. And no one's ever had it before. We don't have any immunity, and so that means that it's spreading quickly. And so staying away, staying home for the next couple of weeks to try to slow the spread is really important.
Stay home. Stay home.
Stay home. Wash your hands. I know everyone's heard those things, and people roll their eyes, but that is really important. Don't touch your face. Mm-hmm. That's a tough one for me.
Because I think it is everyone's natural instinct to think worst case scenario. I think there are some positives that we're learning
Sure.
from the experiences around the world. For instance, not everyone exposed to it is probably getting it.
Right. There are some positive things about it. 85% of people have mild to moderate symptoms. Some people have little or no symptoms. So I suppose that's good news that most cases are not serious. The thing that makes this different, from the seasonal flu is there is a bigger percentage of people potentially that could get sicker and have serious consequences. Particularly older people are more vulnerable, people with health issues. And that's part of the reason I have college-age kids, and they're like, "Dad, what's the big deal? If I get it, it's going to be like the flu." And that's true for them, but it's for grandparents and older friends and family members. That's what we're doing this for.
I think it was very helpful when a few days ago the message was somewhat refined to be protect yourself to protect the most vulnerable among us.
Yes.
And that's why we're doing the things that we're doing. Hopefully, if some, I still consider myself of the younger population. I think I would be okay. Not necessarily. I mean, but
Sure.
I was interested to see when the numbers came out and they broke them down by age. The biggest numbers right there in the 18 to 49 group.
Right.
But most people are surviving. There are some good things that we know,
Sure.
and so panicking is not different. Do you have an opinion at this point? You may not, but do you think when this virus passes that we're going to see it being quite different than the other viruses of years past, H1N1, the swine flu?
Yes, I think in some regards it will be similar, but I think it will be, the most severe flu season we've ever seen. And, the concern in the healthcare system is that with, as it's spreading quickly, is that the hospitals will get overwhelmed. At Sumner Regional, we have been working for 6 weeks to be ready for this. And we've got our plans in place. I think we're as ready as any hospital in America. But that's the concern in the healthcare community, is that this will happen quickly because a lot of people don't have immunity. Well, no one has immunity to it. That the healthcare systems will be overwhelmed. In fact, one of the things that I would advise, because a lot of people have mild or moderate symptoms, we're getting a lot of calls about testing and should I get tested. And I like what you said. If you've got cough and cold symptoms and you think you might have it, you might. And the treatment is to stay home and self-isolate. There is not a specific treatment or vaccine right now. Our researchers are working on that, and hopefully that will be coming down the pike. But if you have mild or moderate symptoms, the treatment is to stay home and stay away from other people. The people that we really need to see at the hospital are the ones with serious symptoms that might, particularly shortness of breath. That's the concerning symptom. And so those are the ones that really should come in. It would be wise, I think most offices and healthcare facilities are like this, to call in advance. We're trying to minimize infectious exposure, so if you can do that. We do have where we can give some guidance. A lot of hospitals have set up hotlines and things like that to whether do I need to be tested or not, and how's the best way to go about that.
Yeah, and a lot of facilities are actually coming to potential patients' cars and doing the test in the car if they screen to be tested. There is so much anxiety from people because they feel like they need to be tested.
Right.
And the chief medical officer for the state today said in a conference call that I was on, if you're asymptomatic,
Don't come in.
yeah, don't come in. You're just potentially subjecting yourself to exposure. But likely the virus, you explained to me, likely the virus would not show up if you're asymptomatic.
It's very possible. But yes, and I understand the concern. I've gotten multiple calls from friends and family. Don't I need to be tested? Don't I know? And if your symptoms are mild, the key is you're still could be infectious, but it's just self-isolate at home. And there's that's how it needs to be managed.
Do you have any guidance on this time? Because these are numbers that we've heard all over the place. How long people are how long people before showing symptoms, how long people may be contagious to others, and then how long after, say, fever has subsided?
Sure. I think the honest answer to all of those, and those are the big questions.
We don't know.
We don't know for sure. Now, based on, there are some things we know, and some things that we're assuming because of similar viruses. So we do know that the incubation period is, on the short end, 2 or 3 days. It could be as long as 14, although it looks like it's clustering around 5, 6, 7 days. That's probably the most common time. You can potentially be infectious when you don't have symptoms. Although just like, the guidance we give when at schools with children, probably when you have a fever and symptoms is when you're the most contagious. If you get it, the recommendation is to be in quarantine really till your symptoms resolve, or at least 14 days. But we don't know for sure. The guess is the symptoms are bad. It kind of looks like this is your infectivity, and as your symptoms wane, it goes down. So.
Well, I know one thing that every business, including our city government, is challenged with is, say someone does become sick and they have a fever and they have symptoms and they test positive, they don't test positive. We don't want to burden the healthcare system by requiring doctor's notes, but when can they safely return? And right now our policy is kind of loose because we figure better guidance will come out as we go further.
Oh, that's an important point, Mayor, because I know everyone's concerned about this, and we're already getting people that, yes, I need a note for my work. This would be a time to be generous, and obviously it's a time of national emergency, and requiring a doctor's visit or a doctor's note is going to overwhelm the healthcare system. I think the stay at home, actually that's what we're being recommended to do anyway, and yes, that would be my encouragement to employers, is to be generous with their time off so that people can self-isolate if they have symptoms.
And individuals need to be responsible and respectful.
Absolutely.
On both of those fronts. We don't want you anywhere if you're sick, but don't take advantage if you're not, because certainly those who are well are going to be needed everywhere.
Absolutely.
Are there any other precautions or words of advice that you would offer?
I think we've touched on all the important ones. The wash your hands, self-isolate. There's guidance coming out almost daily, I know from here, but at state and national level, and if they encourage people to stay home, please do that. Again, that's really my biggest concern as a healthcare provider, is we don't want the wave to hit so quickly that the hospitals are overwhelmed.
Can't keep up, because
Right.
there are a finite number of ventilators, which is the difference in this disease, I think, from the others, in that so many who do find themselves in respiratory distress require ventilation, and that's the fear of hospitals becoming overwhelmed,
Right.
and that's why we need to limit the spread, because
Absolutely.
that will reduce the burden and ultimately the potential loss of life.
Absolutely.
And that is our goal here. And hopefully along the way, medical professionals will learn more information and they will be doing much better with stuff. Is there a question for the
Yeah, I have a question
We may not
from
be able to answer it, but
Kristen Farley online asks, what about pregnant women? Are they at higher risk?
So that's a great question. We know back from H1N1 there was some evidence that pregnant women tended to do worse. We have very limited data right now. They don't. Now that could change but the data that we've gotten out of China, it does not seem to be the case. And you mentioned kind of the silver linings. Children or people under the age of 20 rarely get ill. In the thousands, no, hundreds of thousands cases now, I've heard of just a handful of deaths in teenagers. None under the age of 10.
that still remains, that's good to know.
Yeah.
That's good to know. But certainly, pregnant women don't need any health complications when they're pregnant.
Right. But yes, as far as we know, they are not at any more increased risk than anyone else.
I appreciate that. Are there any other questions?
There was a question if you were at home and you're self-caring at home for COVID-19, if you get it, what would you do to care for yourself at home?
Sure. This would be if you get short of breath and have trouble breathing, that's when you need to go in the hospital. Short of that, it would probably be the things that your mom told you to do when you had the flu: rest, fluids. Oh, interestingly, there's some data coming out that maybe we should avoid ibuprofen. There's so many things I know, but that's some experts in France are seeing a correlation with worse outcomes. So rest, fluids, Tylenol, and give it time. It's for most people, it's like a severe flu. It does take longer though. You're not going to be chills and achy and coffee, and the next day you're going to feel better. It could be a week or 10 days or more. So be patient with that.
Yeah, and I will address testing because again, there's anxiety about people feel like people are not being tested that need to be. But I think the medical professionals are just being cautious to make sure that there aren't enough tests available for those who may be seriously endangered.
Right.
So
I think like a lot of healthcare professionals, we'd sure like to do more testing, and we're hopeful that's coming down the pipe.
quickly.
Yes, quickly. Hopefully, that's what we're hearing. But right now, we're limiting it wisely, I think, to symptomatic people that might need to be in the hospital. So.
Well, I appreciate you so much, Dr. Lifferth. We certainly, on behalf of the City of Gallatin, appreciate Sumner Regional. You did begin preparing some time ago.
Yes.
We were just discussing, we had a meeting we think it was a week or so ago. We just don't actually even remember because it's been so crazy since then. But appreciate you caring for our citizens and looking out for the good of our community. And thank you for coming over here for just a minute. I hope it offers a level of comfort and a tad bit of knowledge so that you can move forward with the hospital.
All right, thanks. We'll see ya.
Thank you so much. In just a minute, Kim Baker from the Gallatin Chamber is going to be joining me, but I do want to go over a couple of things that may be of interest to you. As Dr. Lifferth said, and I will reiterate, it is important that we all take steps to limit our exposure. As I said, we're doing this to protect the most vulnerable among us and also to keep our hospitals from becoming overburdened. I ask that you follow the CDC guidelines. They are changing, but definitely social distance in every setting. Stay home whenever you're able to stay home. Practice strict personal hygiene, including hand washing and space disinfecting. If you feel sick, stay home. Don't go to work. Contact your medical provider. As he said, please call ahead. Do not show up. Let them know you're coming, and they will share their protocol for visits with you. If your children are sick, keep them at home. Again, contact your medical provider. If someone in your household does test positive for coronavirus, keep the entire household at home. If you're an older American, stay home and stay away from other people. And don't hesitate to, I'm adding this, this is not official guidance. Don't hesitate to reach out to your neighbors if you need someone. And if you're a person with a serious underlying health condition, such as a significant heart or lung problem, stay home, stay away from other people. I do want to mention that I realize that so many of our businesses are doing their best to provide goods and services. yet they're also worrying about their workforce and being able to keep their doors open. I hope that we do continue to patronize our local businesses. They're working hard to serve their customers in new and innovative ways so that everyone is better protected. The City of Gallatin is striving to keep our services to our residents as uninterrupted as possible. Our offices are currently open. We do encourage people, however, to conduct business via phone or email. We plan to continue holding our critical meetings, including the Gallatin City Council meetings and the planning meetings. Could become virtual meetings or electronic meetings. The state legislature is actually considering that today. I haven't heard an outcome. If that is allowed by the legislature, we may then be doing that, but we'll let you know how we're adapting for that. If you do at this point have remarks for public comment or public hearings, you can submit them by email to cityofgallatin@gallatintn.gov. Right now, we have not shut meetings to the public, but I would encourage you to stay home and participate. We will be streaming those meetings. I shared that the recommendation for those who fear that they have the virus is to call your healthcare provider, not to visit until you've done so. And I do want to mention that there has been a lot of concern over the recently declared state of emergency. We did that last night, or I did that last night. I want to assure everyone that this is a procedural action so that decisions could be made without the need to call a special called meeting of the City Council. Helps us be very nimble in the event that there is a spike in disease level in our community. I do not anticipate at this time any orders that would affect anyone personally or in any business in any adverse way. There may be orders, but hopefully they will be ones that will just help us operate better. I continue to share guidance. I think that's the best way to help our community survive what we're going through at the moment. And I will continue to request that we all do what we're supposed to be doing. Our community is a great community. We support each other. And I see evidence everywhere that people are taking our request and our guidance very seriously. Again, I thank you for that. I did have some questions I wanted to answer. Some of them may have been answered by Dr. Lifferth, some may not have been. The first question is that people are curious about what the city is going to do about public events, civic centers, restaurants. Right now, we are encouraging restaurants to stay open, to find ways to serve their patrons either through takeout or curbside service, or if their dining rooms are still open, to make sure that they provide opportunities for safe social distancing in their dining rooms. What arrangements will be made to avoid electric and utilities cutoffs for those of us who are out of work? That is something that we are working on addressing currently. I do not have an answer for you at this time. Guidance will be made public when we have that. Somebody asked, are they even testing in Sumner County? I can tell you, yes, absolutely, they are testing in Sumner County. But as Dr. Lifferth said, they are testing following screening, and the symptoms must be there. I think that's how they're gauging it, that if everyone has the symptoms that they're saying, then they would test for it. Someone asked, is it accurate that there are only 500 tests available in Tennessee? Again, in the conference call we had this morning with the governor, he says that they are working to rapidly provide for more tests. I think that they've already tested more than that number, so I don't think that number would be accurate.
Which one?
Did you see that number today?
I did.
Kim has joined me, and she's going to be giving us some information in just a few minutes.
How many tests they've administered?
How many tests that they have
Hang on, I
administered.
can pull it up real quick.
I thought I pulled that up this morning or
Well,
this
they
afternoon.
just, yeah.
Statewide, they are saying that. Total COVID-19 tests completed, and this was the 2 o'clock update, 369, 345 of those were negative, 24 were positive. That's at the state public health. And then at the laboratory, the numbers did not print.
It's
But
74 at commercial and private labs.
no, it's more than that, because I see through the bottom of 3 numbers. So, is that to
That's the total. So 74 plus that.
those are the total positive. I think what this
I
is
see.
telling us.
With the test. Oh,
Yeah,
yeah.
they're talking about the number of tests was at
Gotcha.
500. The numbers add up to more than 500, so that would not be accurate. And then, will the number of tests performed in the county be made public? I would say no, because many are being performed by the state, others are being performed by different labs, and gathering those numbers together, there may be a privacy violation in that, but I see more it being a practical concern that wouldn't be happening. Oh, this is a good question. This is one we've had several calls about. If you go to Davidson County for treatment or testing, will you be counted in that county or the county in which you live? You would be counted based on your place of residence. I know that there's an interesting article I read today about someone in Knoxville who was diagnosed. Technically, the person has not been in Knoxville for months because I think they have a second home somewhere and they've been traveling. So even though that person has not even been in Knoxville, that is a Knoxville positive test or that county positive. And
I just got a text. This is funny. This is a little humor. I just
Oh,
got a
okay.
text
We'll
from my
take it.
mother that said, "Stop touching your face." I'm really trying.
it's hard. It's so hard, but that's a really, really big thing. Did you have any other questions on the Facebook Live feed that you wanted us to address?
Some of them are medical. One was elderly couple at home. One gets fever. What does the one who doesn't have the fever do?
Social distance.
Social,
So-
yeah, and stay
I
home.
mean, again, we're
too.
not medical experts.
No, but
stay
from
away.
what we've been told, and that's, I think we'll talk about some of the options in the community for both of those folks to be able to stay home and, self-care, care for each other, and get supplies and things as needed.
As I mentioned, Kim Baker, CEO of the Gallatin Chamber of Commerce, is now here with me. And Kim and the Chamber, like so many organizations in this community, and I don't want to discount any of the efforts that our churches, our individuals, certainly our city employees, private sector, industry, business, everybody is really doing so much to make us be able to get through this fast. I think that's the key, Kim. Don't you feel like that? Let's get to the other side as quickly as we can, and we can all play a role in that if we do the things that we're supposed to be doing.
Yeah, and I think the best way to do that is together, like you said.
Absolutely. But talk about some of the things that the Chamber is doing. You're really rocking it already. So.
Well, thanks. It's that's encouraging to hear. It's this has really made us take a step back as a chamber, and we have at Like the City, we've continued to meet. I had an emergency executive board meeting on Monday just so we could talk about how we're going to serve our members in the days ahead, what this looks like. We had a interesting video and conference call with 19 people on Tuesday morning. That was fun. So I'm sure a lot of y'all are facing challenges like that right now. But we did. So business as usual as far as that, just a little different. And one of the things that I know we talked about on Monday when we filmed Baker and Brown was the Chamber's mission is to foster economic vitality in the Gallatin area. And how do we do that in a time like this? And how do you do that in a time like this? And I think that's the biggest question so many have. And we've really just kind of decided we just start calling businesses and say, how do we serve you right now? I know yesterday, Debbie Haddock, one of our team members, she went through all of our church members, our church members that are members of the chamber, and called each one of them and said, do you need tech support? Because we know a lot of our smaller churches aren't necessarily online, because we had bigger churches like Freedom and Long Hollow reaching out saying, hey, we're here to help those smaller churches still conduct service. Calling some of our different folks, restaurants, we know they're taking a big hit right now. Calling them saying, what are you doing differently? How can we help you? Do you need help with social media? Do you need help with content? Can we help you get online payment solutions going? Like, what does that look like? And then, of course, our retailers, encouraging them to start thinking about online sales. I know you were there on Monday, as was James Fenton with our Economic Development Agency, and we launched a small business task force, a COVID-19 small business task force. Who would have thought we would have ever had an initiative like that? But we brought about 12 different folks together and to talk just about what they were doing, people that were performing well already in their sectors, doing things differently, innovating already, and just saying, what are you doing? How can we help everybody? And so since then, the Chamber has launched a Facebook group for our businesses, and we've started dedicated threads for different business sectors. So if you're a retail business, post here and tell everybody else what you're doing. And then just idea share, fitness, wellness, nonprofits, childcare. We also, for the community, we've added a tab to our website, Open in Gallatin. We launched a social media campaign on Monday called Open in Gallatin, really just to encourage folks to still remember that business is still open in Gallatin. They just may be conducting business differently. We're really advocating for our businesses to still remain operational to the best of their abilities, obviously following closely the CDC guidelines. So,
I'm sorry, I have a question. 2 or 3 people have chimed in and said something to the effect that is this going to lead to Gallatin shutting down? Are we going to be quarantined?
I hope not. I certainly hope not. Back to what I said about the state of emergency a few minutes ago. I don't anticipate any orders at this time or in the near future. They're going to adversely impact any person or business. I prefer that we all operate under guidance and suggestions. I think we work together well that way, and I want us to continue to. The state of emergency was so primarily so that we could, or that I could make decisions without calling a special called city council meeting, which would mean several days delay. This emergency order allows decisions to be made without them coming together and issuing approval. And in dire straits, craziness, which we're not going to get to, I'm very confident, I would have the power to execute those kinds of orders. But if we all keep doing what we're doing, we won't have to do that. And I just don't think we will, folks. And I don't want people worrying about that. I want people to continue to do all the things that are proving to stop, slow, eradicate the spread. So, and ultimately that dang virus. Talk about pandemic powers.
Yes, before I switch over to that, can I tell you one
Oh,
more
absolutely.
thing? The Open in Gallatin, if you go to our website, which is gallatintn.org, there's actually a tab under programs and events you'll find called Open in Gallatin. And obviously I can't show it to y'all right now, but you can go to different resources on there. So we have resources for small businesses. We have a listing of takeout and curbside options. We're starting to collect those, and we're trying to put them on as fast as we can. So if you see something that's not on there that let us know. Local health updates and remote working tools. We thought that was really important for a lot of folks in the community that are having to go remote right now. And so we've gone ahead and done our research for first some of the businesses in the community that can help get you online immediately. And then also a lot of the tools, QuickBooks Online, Gusto, Google Suite and Hangouts, Office 360, Zoom, and a lot of programs like that are offering free, discounted, special rates right now because they know everybody's about to have to shift gears.
Let me share one thing too that I received information on yesterday, and since you commandeered my phone, I don't have it at my fingertips, but Xfinity, the internet provider, they are actually, during this crisis, allowing free access to hotspots for anyone, whether or not they are an Xfinity subscriber. Good. So an Xfinity hotspot anywhere can be accessed by you, whether or not you are a subscriber. They are also kind of extending what they call, I think, their Internet Essentials, and that is for low-income families. And what they're doing at this point in time is that if you don't have Internet Essentials and you want it because your child's now doing online classes or whatever, you can get it for 60 days at no charge. And so you can sign up for that at no charge, which would be very meaningful to some people, I'm sure. And then if you are an Essentials customer, they are not doing any cutoffs at this time for lack of payment. So staying connected is so very important to so many of us, for most of us. And so I appreciated that outreach from that.
I think that's awesome.
Business and just wanted to share it because I think it could be useful. And there are lots of things like that out there. So
a lot of our local folks too.
Yeah, and so keep looking, keep sharing those resources. The local folks are going to be the ones who have to hardest, and Kim and I are both very attuned to that, and will help all that we can. We don't have a lot of information at this point about what are going to be all the relief programs. Certainly about the Tennessee Assistance for Needy Families at this point through the state. That there is state and federal legislative efforts to provide additional support for businesses of all shapes and sizes. Mm-hmm. And I cannot relay the details accurately to you on that, but I think that we will see more guidance over the coming weeks. And you were going to talk about Pandemic Pals.
Yeah, Pandemic Pals. So we launched Pandemic Pals on Monday. In a nutshell, Pandemic Pals pairs, you can sign up whether you are a healthy, lower risk individual, and we realize that everybody is at risk here, but we know that there are some that are at higher risk. So a healthier, lower risk individual, we're asking that those folks be under 60, no pre-existing conditions, no showing of symptoms, can sign up on our website. At the same time, high risk, those that are over 60 have other conditions. They don't have to be over 60. You could be in your 20s and have an autoimmune disorder. Or have a child that maybe you don't want to go out and risk. And so you can sign up different PALs. And what we're doing is we are matching those PALs together based on addresses. And so I actually matched our first two just before I came over here, both of them here in the Gallatin area, and I was able to find them a PAL that was less than 2 minutes away from their house. And so we have had over right at 200 helping PALs sign up. So we're calling them helping or helper PALs and need help PALs.
That's amazing.
It's really neat.
I mean, that speaks so strongly to our community and their willingness to participate in something like that on a moment's notice.
I know.
Really. Kim won't share this, so I will. But she actually spoke to someone that had a program going in a similar program in a different community, not in this state, right?
Mm-hmm.
And they couldn't get any helpers. So how blessed are we that we have so many people who care for their neighbors. Again, is what's going to make a difference in all of this for us. I want to share two things that Governor Lee said this morning. He was doing this conference call with municipal mayors, and he said two things that were really, really meaningful. One was that we're Tennesseans and we're made for this. I'd certainly say we're Gallatin folks. I've never known what the word is for that. I don't like Galatians or other things.
Gallatonians. I don't like Gallatin folk.
But we're from Gallatin, and we can handle this. And another thing that he said was the best of Tennesseans comes out in the worst of times. And you know, we're going to get through this. We're going to be better. We're going to be stronger on the other side. And we just all have to continue to do our part. And I last night was feeling particularly stressed because I was getting a lot of criticism thrown at me, a lot of fear over the state of emergency, and some criticism about some other movements made by the city government. And honestly, I started praying about it. And then, in fact, Kim was the first one I shared this with last night via text. I said, it occurred to me, if no one gets ill, yeah, we're going to be viewed as crazy and this is a conspiracy and we have created an unnecessary crisis. But then on the other hand, if someone dies, we won't have done enough. So that's where we are, and that's why we're doing all that we're doing, and we want to keep the outcome as good as it possibly can be. It's not going to be perfect. It's not going, but as good as it possibly can be, and I so appreciate all that everyone's doing to make that be true. Anything else that you want to share at this time?
No, I mean, I know we've got a lot of folks watching right now. I would just be careful what you're sharing, the content you're sharing on social media right now. I know we're all really plugged in. I think social media is like on the verge of breaking, actually. It's been like so slow and lagging, and I know there's been glitching. But I would really encourage you to push out positive things, like post something else. Like I posted a picture of my daughter in a sunshine she drew yesterday, or post something good that happened, or a piece of art you made or a song you like, and just be careful about the sources you share and the stories you share right now, because there's a lot of I know earlier you said we crave facts, and we're all so hungry for facts, and I think right now we're quick to assume something's a fact.
Yeah, it's really hard to live in a world with a crisis that doesn't have facts tied to it, but we're going to get through it. But you know, do something kind for somebody else. I had a girlfriend that sent me a flower and a smiley face balloon, and then I had another friend that sent me one of my favorites, which I will say is pimento cheese from Southern Bites. It was delivered, so Southern Bites is another one of those that's out there doing deliveries, and so we appreciate it. I'm going to advise you, we're going to say goodbye. We're getting long here, we know. Please continue to stay up to date with CDC information and the state of Tennessee guidance. The City of Gallatin will continue to strive to keep everyone updated via our website, which is gallatintn.gov, and our social media channels. Finally, I'm going to ask, and I know you will, let's use common sense. Let's look out for each other. Let's be kind. Do limit purchases so people can get what they need. There is not a shortage in the supply chain. Just stores are having a hard time keeping stocked because people are stockpiling. In that, let's be compassionate and mindful of our fellow citizens' needs. As I said, we're going to get through this faster if we follow the advice of the experts, and we're going to have more peace if we do the right things and consider others' needs. You can call my office at 615-451-5961. You can email me at page.brown@gallatintn.gov. If you have any comments, questions, or suggestions, I'm sure, along with Kim, Wish God's blessings upon each of you. We pray that you and your family stay safe. And I will say finally that we will, as a community, a state, a nation, a world, be stronger and better on the other side of this crisis. So hang in there, folks. We love you. Appreciate your love for us and for Gallatin. Goodbye.
Bye.